Hi everyone, welcome to my live session today. I'm Dr.RakheeYadav, consultant pediatrician, and my topic is COVID-19 experiences from Singapore today. And I have with me a very special guest, Professor Dr. Ravindran. He's a senior consultant and deputy head for the National Cancer Center of Singapore, and he's also an associate professor of Duke NUS Medical. And I will just invite him on board. Just give me. Hi Sachin, thanks for joining. Hi, Prof. You will get a, yeah.
Hey, hi, Rakhee.
Hi.
How are you?
Hi. I'm good. So is it Prof or is it Ravi or what should I call you? Ravi. That's awesome. It's so nice to see you after so long. Thank you so much for doing the live session with me today.
Oh, no problem.
So I've just introduced you and just before you joined in. So would you like to just tell us a little bit about yourself before I go straight into a couple of questions?
Sure. So I'm a medical oncologist and I work at the National Cancer Center Singapore. Been with the center now for about 13 years, and I'm a medical oncologist who specializes in urological cancers. So that's my area of interest. So prostate cancer, bladder, kidney, those kind of stuff. So that's basically it. I also teach in the medical school, which is the Duke NUS medical school that's affiliated with our institution.
Okay, and how long have you been in Singapore?
So now 13 years this round, because I did some of my education here before in secondary school and junior college as well. So, yeah.
Excellent. Okay. So I'm going to go straight into a couple of questions.
Sure.
What is the current situation in Singapore with regards to COVID-19? I know you're doing much better than us, so please don't brag.
Malaysians. No. I mean, I think this pandemic has affected many countries globally, and of course some have done a bit better than others. Interestingly, actually, the numbers here started to taper down up to about 2 weeks ago, and in fact there's a stage where like nearly a week there was just 1 or 2 community cases per day, and they were mainly all imported. Unfortunately, last week, and this has happened to us a few times before, there was another wave. So there was a KTV, they call it the KTV cluster, the karaoke, lounge cluster. And that unfortunately now has burgeoned into a cluster that has, nearly 200 people who are afflicted. That affected also a market where there's wholesale, fishing, fish products that are sold there, and that's become another cluster. So now, in fact, today we hit 183. So from 0 or 1 case 2 weeks ago, today is 183 community cases. And we've scaled back to phase 2 heightened alert. So that means restaurants are closed again. So people can only, buy takeaway food or get deliveries done. So up to today, you could still go to a restaurant, but this starts tomorrow. So again, highlights the fact that, these waves will come and go, and there's unfortunately, a lot will depend on how responsible people are, and of course, vaccination rates will help as well. But yeah, so it's that's how it is right now.
That's the current situation. Excellent. And do you know the current status of the number of cases that you have in Singapore in total?
Yeah, so in total from the beginning, it's now about just over 63,000 cases. We've been very fortunate in terms of mortality, so that's just about 36 people have died from COVID. There were another 15 who had COVID but died from other causes. So mortality has been very low. And the main reason for that is because we were fortunate that our healthcare system was not overwhelmed. I think in many countries, the struggle has always been ICUs are full and all that, but we're still on alert. At this point in time also, there are not many patients in ICU. But one thing is that amongst the 63,000, more than 55,000 were part of a worker dormitory cluster. So they were all foreign workers who were in dormitories that were very crowded, and so there was a lot of transmission and cases within those clusters. So the general population actually wasn't super high, but now we're pretty worried that 183 cases today. So fingers crossed that we'll, ride through this. I know this is still not that bad compared to, many countries, including Malaysia. But
just like 12,000,
I know. Yeah, it's
tell
just
you today.
unfortunate. No, I feel, it's terrible, right? I feel quite bad for
Horrible.
how things are over there.
So in Singapore, I guess we just hope that you didn't go for karaoke on that particular
No,
weekend, or
no, not involved.
so
Yeah,
it's good that it's not a community spread in that sense. It's so cluster based, so that in one sense is a
yeah.
good,
You're right. No,
bullying.
I think one of the strengths we have is the contact tracing is good, and I think being a smaller country and island, it's easier to maybe do this. But still, a lot of credit to the Ministry of Health and the folks that are doing this on the ground. I'm sure it's a lot of work, but I can imagine this is a lot harder in Malaysia and other bigger countries, Indonesia, or worse still, even India, where the population is so big that it's very, very hard to really do contact tracing, and a lot will depend on individual responsibility to go and isolate themselves and make sure they don't expose. But it's a very tight balance between earning a living and isolating yourself and losing your livelihood. It's really challenging. Yeah.
It's a struggle in most countries worldwide, but
Yeah.
in Singapore, you have quite a few number of cases lately, and so I think that's where everybody is going into panic mode. So what has Singapore government, what are the measures in place that they've actually put in to sort of safeguard its population? Because you've got a much smaller population,
Yeah.
but still you need to make sure that the working force is able to work, because there's so much of dependence on everybody that is there. So
Yeah.
what do they have in place?
So I think the big thing is the focus on vaccination, and that's the key thing, right? Vaccinate, vaccinate, vaccinate. So here, about 3-4 weeks ago, they ramped up the numbers. So now nearly, even the younger population, a lot of people have been vaccinated. So the exact numbers, about half the population adult population, means those that are 12 and above, because they even give younger teenagers up to the age of 12 the vaccine, because Pfizer vaccine has been approved for that age group. About 50% have received both the doses, and nearly 70% have received at least one dose. So a vast majority have received vaccination. So that's why, even with the growing number of cases, the number of patients in ICU is very small. If I'm not mistaken, last week was just one person in ICU for COVID. So vaccination has been the big key measure. But I'm still very impressed with Malaysia. 400 over 1,000 vaccinations per day. That's a mammoth task. So that's, I think, something that the government has done very well, and they're going to ramp up to 500,000 per day. So that's very, very impressive. Yeah. So we are doing about 80,000 a day.
80,000 a day. That's a pretty
Vaccinations.
good
Yeah.
number comparing to the size of
That's
the
our population.
country and
Yeah.
the population, because we've got huge mega PPVs all around,
Yeah.
and I think vaccine issues in terms of stock and all that is just a perpetual problem with most of the developing countries. But
Yeah.
about in Singapore, do you have stock issues, or is this basically
Yeah, so that's not been a problem. I think very early on, the government had already kind of gone in with arrangements with many of the big pharma that were developing the vaccines, and kind of choked these vaccines for use. That has not been an issue. In fact, I think last week the government actually mentioned that they'll be donating some of the vaccines to our ASEAN counterparts. So I think, yeah, so that's not been an issue. No issues with PPE and all as well, because like I mentioned, the ICUs are still fairly
not overburdened?
yeah.
Yeah. What are the vaccines that you have in Singapore? Because
So
I think you have two.
Yeah, so Moderna and Pfizer were approved and used from the beginning, but because the government had also stocked up on some Sinovac, they have allowed for its use only for patients who do not want Moderna or Pfizer. Then they can get this from their selected number of general practitioners. So this is not what's given in their mass vaccination centers, but
In for Sinovac.
yes,
An
correct.
Oh,
It's an opt-in.
okay.
Yeah.
But it's still free? All three vaccines are
Yeah,
free?
all three are free. But if you go to your GP to get the Sinovac, then you have to pay the treatment cost, which is just to deliver to deliver the injection. But the vaccine is free. Yeah.
That's fine. And what about, like you mentioned a couple of phases, phase 1, phase 2. Like in Malaysia, we have multiple SOPs. There's lost count of MCO, which SOP, what, but you all, I see you have a lot of nice infographics. Singapore comes up with, because I follow Singapore news quite closely. My brother's also there. And they come up with these nice infographics. It's very clear, like number of people that you can dine in at phase what and all that. So how many phases do they have, and what do they complete?
No, so far we've only reached phase 2. Phase 3 is when they really open up. So phase 2 at its best, they allowed like 8 people to go out in groups and 8 people to dine in restaurants. But that got scaled back about 2.5 months ago because the number of cases again went up. There was another wave. And then they reduced it to 2. So 2 people can go out of the house and 2 people can dine in. And then in between, there were times when they didn't allow anyone to dine in. So as of today, they still allowed up to 5 people. So from 2, they went up to 5. And this is all part of phase 2. So phase 2 has the normal phase 2, which was the 8. And there's phase 2 bracket heightened alert. So it's not actually very different from EMCO. And I guess not as complicated. There are not many permutations, but it's phase 2 heightened alert. And so they went up to 5 up to tomorrow. Then they're going back down to 2, and they're not allowing restaurants, any dining in restaurants. So that's where we are right now. Actually, no dining in from Thursday.
So they're just basically 3 phases as well, and you've been moving back between phase 1 and phase 2.
No, so we've been moving within phase 2. Phase 2 divided into heightened alert. Yeah.
Okay. Right. And what has your experience been? Like you mentioned, you've only got very few ICU patients and all that. So what about the Cat 1, Category 2 patients? What's your experience managing COVID-19 patients?
We've been fortunate at the Cancer Center. We've been very stringent in allowing patients in because we check them very thoroughly for their fever and all that, get them to make all these declarations as to where they've been and all. So actually, to be honest, the Cancer Center has not had one COVID patient. But like I said, it's been really, a lot of hard work in doing all these assessments before the patient come in, because cancer patients are at the highest risk of getting COVID and dying from it because they're all immunocompromised. They're on all these chemotherapies, targeted therapies, immunotherapies. And a lot of these things actually render the patient immunocompromised and likely, succumbing to COVID if they do get it. So they've been high on the priority now to also get vaccinated. Initially, there was not much data, but now we have a bit more data from the US and Israel that seems to indicate that even if you're on chemotherapy or immunotherapy or some of these cancer therapies, you should still get vaccinated. And there's not much of a downside or risk to that. Initially, the thinking was if you're immunocompromised and you get these therapies, you may not be able to mount an immune response. So you may not be as well protected. The studies show it's true. After the first jab, you may not get as many antibodies, but after the second jab, you actually get back to the levels that someone in the normal community or population will get. So I don't have any experience treating a COVID patient, fortunately, because we've not had
So you have actually prioritized your cancer patients to get the vaccine, like in your center. So were they prioritized in the beginning of the vaccination program?
So they were not, because we were not sure how safe it is, or more importantly, we don't know whether they'll build an immune response or you get as much benefit. But now with the data, we have kind of ramped it up. So every time in clinic, we'll discuss with them, and we have a way to order it for them where they get it within our institution, so they don't have to go back to the community. But we are now trying to get that done as soon as possible because they were lagging behind, primarily because we didn't know how effective it will be for them. Yeah.
All right. So what are the difficulties now that's being faced by Singaporeans who have family back in Malaysia? I know so many. I was in Johor. I stayed in Johor for a couple of years, and I have many friends who travel back and forth daily for school, education, for a lot of reasons. And it has not been open for the past almost 2 years. So what are the difficulties that you see? I mean, you have family back in Malaysia as well. So what have you seen? What are the difficulties you have seen in the past almost 2 years?
So you're absolutely right. Every day there used to be nearly 300,000 people that travel back and forth, 250 to 300 every day. And can you imagine now it's whittled down to zero, nearly zero. Like it's totally close, right? Because if you want to travel across, you have to quarantine there. And then when you come back here, you have to quarantine as well. So that's a month lost. So it's been challenging, and for those with jobs, obviously that's not possible, right? So I think this has been featured a lot in the press here as well, with a lot of Malaysians who either lost their jobs because they preferred to stay back home for family reasons and all that, or they came here and they've been staying here and they've got disconnected with their families as well. My dad's there in Ipoh, and my siblings and all that. Um, it's just difficult. I guess now a lot of communications via modalities like this, WhatsApp video, FaceTime, is not the same. And it becomes even harder for people who have loved ones who fall ill or unwell, and then you can't cross over to, see them in the hospital, or even, when they pass on, can't attend funerals and all that. It's been very, very difficult. I mean, technology has helped. Like many years ago, when there's no video calls and all, I can imagine it was so much harder. So I think this is not just unique to Singapore, Malaysia. I'm sure people who have families in other countries, whether it's Australia or Europe or US, can't travel. So they're all stuck. So we just find ways to cope with it.
We have a comment, a question from one of the viewers. It says, how does Singapore government support small businesses? So any incentives, like in Malaysia, we had a few, B40 programs, M40 programs, and all those kind of, and then the ETF withdrawals, basically taking out our own money, some sort of help in ways here and there. So what has Singapore done for it?
Actually, they've done a lot, and I think because they started with pretty good savings, in that they could avail themselves to. So initially, with the first period where there was a lockdown, we called it a circuit breaker. All those, most industries receive up to 75% wage supplement. So anybody who earns up to 4,005, the first 4,005, 75%, the government actually paid the employer to keep them employed, because the key thing was to save jobs, right? But of course, this only applied to the locals. So Singaporeans got up to 75%. And that continued for the industries that got hit the hardest. So like tourism, which is a big, industry in Singapore. So that was maintained. And then slowly, as things opened up, they reduced that to 50% and further reduced to, I think, 25 or 10. But now, of course, things have closed up again. So again, they put in more money to subsidize. I think last year alone, they announced about 5 different budgets. I think all the countries had to go through this to help supplement what people earned. They even helped out people who were part of the gig economy. So, like Grab drivers, or people who, didn't have full-time employment. So there was support for them as well. So I think overall, a lot has been done to keep jobs for the locals. Of course, many expats had to leave the country when their jobs became, unavailable.
Yeah. A lot has happened actually in the past 1.5 years, and I think the ones that have stayed on have resiliently done so many things just to survive in Singapore. And the cost of living is not very easy as well, and and getting a HDB flat is also not something that is as simple as people think it is. So there are a lot of difficulties, but I think resilience is one of them, one of the characters that Singaporeans have, and I think that's fantastic. But what are the border rules at the moment? Especially for the Johor Causeway.
Yeah, so I think for people who are working, you definitely can't travel across daily. So you have to choose. So what happened is, at that point when they closed the borders, a lot of them actually decided, because they had to, safeguard their livelihood. So they just moved over. So they had to look for accommodations in either renting, sharing rooms, HDB. The employers helped them out. So many of them have not gone back, and some who have needed to go back, whether because their wife was delivering or for whatever reason, then they just do the quarantine. So they go back, they quarantine for 2 weeks, then spend a bit of time and come back. Of course, the employer must be supportive, but there are people who could work from home, and some of the Johorians who could do that then just stayed back in Johor, because what now the default in Singapore is, if your job can be done from home, you're supposed to stay at home and just work from home. Only if you have to go to the office, then they allow you to go to office. But otherwise, you're not supposed to come to office. So those who in those kind of jobs, IT or where they could actually do everything online, they would just stay behind. So there's some people in JB who are doing that. But I sympathize with many of those who actually lost their jobs because they couldn't come over here. So that's been a big problem. I think in JV businesses have been hit very badly. Their malls, a lot of it were, frequented by Singaporeans, and now there's just no one coming. Yeah,
Cowboy town, empty.
tough.
It's really sad,
Yeah.
because I grew up in JB for quite a few years, and it's really sad to see everything has just, if you see those dust balls in a cowboy movie, it's like that empty on the Causeway Road. So yeah, it's really hit. I mean, Johor town has been hit very badly. But so talking about quarantine, so for Malaysians, as far as I know, the borders are open for Singaporeans, right? So Singaporeans, if you're a citizen or if you're a PR, you can enter back into Singapore, provided you do your 2-week quarantine and all that. Has there been any difference in terms of if you're vaccinated or not? So like if you're vaccinated, you don't need to quarantine, or it's just blanket rules. It doesn't matter whether you're vaccinated or not. You still have to.
No, that's a great question. So they haven't done that yet, except I think there are 4 countries where potentially you can come in because their rates are very low. I think it's Brunei, New Zealand, and 2 other countries. I don't know whether it's Hong Kong and something else. They haven't actually formed bubbles where people can walk in. So these countries, they come in, but they have a shortened quarantine of 1 week. But Malaysia, actually, for anyone from anywhere, you need to get a permission to actually enter the country. So there's no short-term visit pass or visas granted. Where last time you just come in with your passport, you just walk across. Right now you can't. You need to actually get permission from any country in the world except a few that I mentioned. And so there's basically no tourism allowed. So you can't come in. So people who have got people in those who have close relatives who need to come in to see family or some urgent reason where you have to get special permission, like medical care. If it's not provided in your home country, you can get special permission from the Ministry of Health to fly in here and then immediately get admitted in hospital and get treatment. But it requires multiple steps, including immigration and the Ministry of Health, etc.
And what about the nasal swab? Like, as far as I know, you have to do a swab at least 72 hours before entering Singapore. And then do you have to repeat another swab when you enter Singapore?
Yeah, so if you're doing quarantine, yes. So you repeat one more as you enter. And then after that, they do one more at day 10, I think. So there are multiple tests that are done. Yeah, initially it even went up to 21 days, the quarantine, when they realized that overseas there were cases where people were presenting on day 15 or day 16 of their quarantine. But later when they looked at the data, they realized it hasn't happened in Singapore amongst those who were quarantined for 21 days. So they brought it back down to 14 days now, if I'm not mistaken.
All right. So, and there's no news of the borders opening up anytime soon? Any inside information?
No. No news. Yeah, I think eventually they will differentiate between those who are vaccinated and not. Because now the question is, how do you need a booster? Is your vaccine good enough to protect you? I mean, there are many cases overseas in many countries where people who are vaccinated are still getting infected. It's just that the good news is they're not very severe, and that's why UK went the opposite way, right? So they had a large population vaccinated, but over the weekend they had 100,000 cases, but they still opened everything up yesterday on Monday. Everything's back to normal. So their rationale is, yes, people will get it. It's fine if they're vaccinated. They're not going to get very ill. So it's okay. They're not going to clog up our hospitals.
Right. So because I had a few questions from some of my followers that asked like if they were going to get any particular vaccine. So like in Malaysia, Pfizer is not, we don't have Moderna. We have Pfizer, we have Sinovac, we have AstraZeneca, and there was news, AstraZeneca. So there was news that Singapore is not recognizing Sinovac. So, those who were getting Sinovac had they were very worried whether they could enter or not. But if there's no real regulation behind what vaccine you got, whether you're vaccinated or not, you still have to do the quarantine. So I think there won't be much of an...
Yeah, as of now. But it will change. It will change.
It might change.
Yeah.
There's nothing.
No.
Yep. All right. Do you have anything that you might want to say to your family back home in Malaysia?
No, just hang in there. I know it's tough. Just stay home, stay safe, get your vaccines. Yeah, rolling out 500,000 a day. Make sure you get yours and stay safe. I know it's just very difficult for everyone. Yeah.
Absolutely. It's been really nice chatting with you, Ravi. And
Rakhee, thanks.
I like getting the down low from the down low in Singapore. So it's nice to accurate information from someone who's there. Someone who said, Dr. Ravi, you still look the same from 10 years ago. See, you found the fountain of in Singapore, so let me know.
Maybe the bad lighting.
No. So anyway, it was so good to have you on my live session today. Thank you so much, Professor
Thanks, Rakhee.
Dr. Ravi.
Yeah, it's good seeing you.
Yep. Take care and stay safe. Bye.
You too. Bye-bye.